We need people to start turning out in force to give blood.
That urgent call to action from Dr. Peter Marks, director of the Food and Drug Administration Center for Biologics Evaluation and Research, comes as fear about the coronavirus is keeping people from wanting to donate blood. Over the past week, blood centers throughout the country have experienced a significant drop in donations, and that is limiting the ability of the nation's blood supply to be adequately replenished.
We need people not to let the blood supply get depleted. We need it not to get to the point that surgeries are having to get canceled. We need an adequate blood supply, and we need people to turn out and donate blood.
The coronavirus does not pose any known risk to blood donors during the donation process or from attending blood drives. U.S. Health and Human Services Assistant Secretary for Health Admiral Brett Giroir says, quote, "It is safe to donate blood. Part of preparedness includes a robust blood supply. Healthy individuals should schedule an appointment to donate today to ensure that blood is available for those patients who need it." Blood centers are regulated by the FDA and must follow specific guidelines to ensure safe blood is available for patients at all times.
It's a very safe thing to do to go give blood, and people should do it because they can really help save lives.
The plea from these federal agencies comes as the entire blood banking community is uniting to urge people to donate blood and for organizations to keep hosting blood drives.
There is an immediate need for blood donation. We need people to donate every time they are eligible. By doing so, you are helping to ensure a ready blood supply. We cannot wait for the situation to intensify further before taking action. Every blood center is now actively preparing for the possibility that the entire country can be affected by coronavirus and the impact that this will have on the blood supply.
Blood drives across the country are canceling. This is going to end up in almost an unprecedented level of blood supply if we're not careful. We are doing everything in our power to ensure that we don't get to critical levels of blood supply. If we continue to see more and more sponsors cancel blood drives across the United States, we're going to reach a level of inventory of which we haven't seen in the past.
If the blood supply dwindles, the hospitals will have to consider how to preserve blood for emergencies and how to consider taking on or not doing elective procedures.
So if you don't have a blood supply, surgery at a hospital basically shuts down because you have to have a backup in case somebody starts to bleed when they're having a surgery. So if somebody needs heart surgery and there's no blood supply, you can't do the heart surgery.
The Armed Services Blood Program, the official blood collector of the U.S. military, is also echoing the call of its civilian counterparts.
As the U.S. military's official blood program, the Armed Services Blood Program always has a mission to stand ready. We are asking if you are able and eligible, consider donating. Take the time to help us stand mission ready.
Blood is an essential part of healthcare, and the need for blood is constant. In the United States, a patient is treated with a blood transfusion every 2 seconds, and this is only possible through the generosity of our country's volunteer blood donors. They are the heroes who make life-saving treatment a reality.
The FDA says there have been no reported or even suspected cases of transfusion-transmitted coronavirus, and that the virus poses no known risk to patients receiving blood transfusions.
We need people to come out and donate blood. It's a potentially life-saving medicine.